from the other video, we discussed about the signs and symptoms of increased intracranial pressure, and now let's just see the ABCs, nursing management for patient with increased intracranial pressure. What actually do we have to do when we have these patients in our settings, especially in the emergency area? Well, the first thing is to maintain airway. That is, make sure the airway is patent. Maybe you can do chin lift, head tilt if the patient doesn't have head injury or spinal injury. But if the patient has spinal injury, you can do jaw thrust. Also, if that doesn't work, maybe we can think of intubation. And this helps to maintain brain so that brain doesn't get into hypoxia or hypoxemia or hypercapnia. The other thing is blood pressure. You have to monitor blood pressure because a well-maintained blood pressure helps in cerebral perfusion pressure, and it helps to maintain adequate blood flow to the brain. You need to be calm as a nurse. That is, you need to be calm in providing your nursing care plan. That is, don't overstimulate the patient. So as a nurse or any healthcare professional, doctor, providing treatment to such patient, you need to plan your care perfectly so that you don't overstimulate the patient. Or sometimes when the patient is very stubborn or has altered mental status, you can think of giving sedative drugs like phenobarbital. It depends with your setting and hospital policy. Then we have to do decompression, that is stomach decompression, because increase in stomach contents can lead to abdominal pressure, and this abdominal pressure will result to thoracic pressure, which results again to increase intracranial pressure. This can be done by inserting NGT, but make sure that your patient is not a head injury patient. And then the other thing we have to think of is E, which is edema. Edema here, you have to know when to place the catheter so that your patient doesn't get much intracranial pressure. And the catheter we do place is the EVD machine that helps to drain out the excess intracranial cerebrospinal fluids. But sometimes also you have to focus on neurological changes. You will see that the patient keeps on changing, and sometimes to reduce the edema we can give a mannitol, which is a hypotonic solution. And being a hypotonic solution, it will help to draw the spinal fluid away from the brain. And then other thing we have to think about is eye movement, and usually we look at the changes in pupil, and this can be done by seeing the reaction to light and the corneal reflexes. And if the patient is more severe, you will see an equal pupil and enlarged pupil size. Then you have to elevate the head to 30 to 45 degrees. So always make sure the head of the bed where your patient is lying, especially where the head is raised to 30 up to 40 degrees. You know what? This helps to give back venous return. So when there is adequate venous return back to the heart from the head, the patient will experience less hypoxemia. So there will be adequate blood supply, and the brain will also not retain blood flow to it. So this will help decrease our worsening of increased intracranial pressure. And then the other thing here, we have to look at F, which is fluid and electrolyte. Usually brain is the part that coordinates with the adrenal, the pituitary gland, anterior, posterior may release the ADH. So during such injury or increased intracranial pressure, ADH might not work. So look for those signs and symptoms, like the patient can be urinating too much. So you have to give the fluid that will counteract that mechanism, where a patient will be able to retain or have a stable hemodynamic situation. And then we have food. Give appropriate food. Like, we recommend that you give food that is full of fiber, and it should be enteral nutrition. It can be through NGT or orally, but you have to test for swallowing test. You know, swallowing test is very vital, because you might be giving food to the patient who can't swallow. And you know, when you do that, there is a high risk of what? Aspiration pneumonia. And mostly 70% of the patients who have aspiration pneumonia usually die. So you have to be careful what you're going to cause to your patient in the next few minutes. So the patient is going to have the worst prognosis ever. And so you have to do swallowing test by giving some little fluid, like a small spoon in the mouth, to see if the patient will swallow. And if he or she retains, you are required to maybe suck it out and give NGT, put NGT, and NGT you should consider your patient doesn't have head injury. Then family concern, you have to advise the family, because we never know what's gonna happen. Maybe the patient can have brain death, so they must be aware of what is happening to the patient. Don't just keep the patient in the room without notifying the family what is going on. And then the most important thing here is neurological assessment, and usually we use the Glasgow Coma scale. It's in my past video, so make sure you watch the video about Glasgow Coma scale. And this should be done after every 1 hour. Don't do it like 6 hourly, and sometimes you have to do it PRI, but because you don't want to disturb this patient, you could schedule it to 1 hour. Each hour you do it, and that's very important to see how the progress is depending on the management that you are giving. And then we have H here, which is for hyperventilation. Please give patient much air, much oxygen, and the more you give, the more you try to alleviate hypercapnia, that is oxygen retention, and this will help to alleviate problems like hypoxemia and hypoxia. And then hypothermia should also be avoided, because if you have hypothermia, that means your body metabolic activity will increase, and now we have brain damage or increased intracranial pressure. The brain can't work well to maintain the increased metabolic activity. Then you will look for hernia. Hernia is brain herniation, where the intracranial pressure has increased to an extent that it can't be maintained. So the last resort is brain to undergo herniation, and when this could be notified by Cushing triad. If you have a Cushing triad, that is widened pulse, decreased heart rate, and irregular respiration rate accompanied by hyperapnea with the apnea. So these are the last dangerous vital signs. You have to be careful about them. And the last one in the management is the so-called ICP monitoring. That is, you should monitor the cerebrospinal fluid pressure by a machine called EAVD if the patient have, and also consider infection if there is a barhole made through which the catheter is introduced to measure the ICP. Make sure you protect that place from infection, because any mess up will cause brain infection, and that's dangerous. Please stay tuned to my videos as I upload. Do not forget to subscribe. Thank you for watching.